What are your thoughts on the so-called traditional treatments like chemo and radiation? I mean, you see patients all the time, and those can be very, very hard on the body.
Yeah, so a lot of people are worried about the side effects from those traditional treatments. And my overall thought on that is that they can be life-saving treatments, and especially with certain types of cancer like lymphomas, ovarian cancer, testicular cancer in particular. Chemotherapy can be life-saving. Surgery can also be life-saving, same with radiation. So in my practice, I generally encourage my patients to take a and both approach. A lot of times we pit natural medicine against traditional or conventional medicine, and I think that we can all win, we can all have our best health when we combine the two together so that we don't have to choose sides and it's not a natural medicine versus traditional medicine. And that's how I recommend my patients utilize cancer care, is to take the best of both worlds and combine them together, because none of us are claiming that we have all of the answers to cancer. I mean, right? That's why we have all these fundraiser drives for research and different opportunities to figure out what is cancer, why is it growing, why are people getting it. And so if we don't have all of the answers in one part of medicine, we need to take all the parts of medicine that are trying to address the same problem and mix them together and get a treatment plan that's just for the individual. So that's what I recommend for my patients, and that's what I've done with my own family as well. When my husband was diagnosed with cancer, my first year of naturopathic medical school, that's where I really saw the impact of pulling both worlds together for a really huge benefit for my husband.
So you have a firsthand kind of look at it, which I think is unique for a lot of doctors, which might help their patients down the road too.
Absolutely. I know what it's like to be in the caregiver seat, and I know what it's like to be someone who's worried about a loved one with cancer, and can really connect with that experience and try to answer my patients' questions or anybody who reaches out to me with questions from that vantage point of my personal experience and how I can use that with my professional knowledge and bring the best care forward.